Did you know that doctors can instantly spot serious health problems just by looking at your personal hygiene habits? These seemingly innocent mistakes could be silently signaling dangerous conditions developing in your body right now, without you having any idea. What's even more alarming is that by the time you notice symptoms yourself, it might already be too late to prevent serious complications. In this video, I'm going to reveal the 6 personal hygiene mistakes that medical professionals immediately recognize as warning signs of underlying health conditions. These aren't just about looking clean. They're critical indicators that doctors use to identify potential life-threatening problems before they become emergencies. By the end of this video, you'll know exactly how to fix these issues before they lead to dangerous health complications that could rob you of your independence or worse. Let me tell you about Nancy, a 73-year-old retired school teacher from Ohio. She always prided herself on her appearance and thought her hygiene routine was impeccable. She showered regularly, brushed her teeth twice daily, and kept her clothes clean. But during a routine checkup, her doctor immediately noticed 3 concerning hygiene issues that Nancy had never given a second thought to. When the doctor ordered additional tests based solely on these observations, they discovered Nancy was in the early stages of 3 serious health conditions that could have been addressed months earlier. By the time the diagnoses were confirmed, Nancy was already facing complications that could have been prevented entirely had she known what these seemingly innocent hygiene mistakes were signaling. Let's examine these critical hygiene mistakes that doctors notice immediately and what they could be revealing about your health. Mistake 1. Neglecting oral hygiene. Beyond just brushing, is your toothbrush the only oral hygiene tool you use each day? This common mistake sends immediate red flags to medical professionals the moment they look in your mouth. Many seniors believe that simply brushing their teeth is enough, but doctors know this dangerous misconception could be putting your entire body at risk. Researchers at the American Heart Association have conclusively demonstrated that poor oral hygiene in seniors directly correlates with heart disease, stroke risk, diabetes, and even cognitive decline. Dr. Sarah Richards, Chief of Geriatric Medicine at Cleveland Clinic, explains, "The mouth is the gateway to the body. Bacteria that flourish due to incomplete oral hygiene don't stay in the mouth. They enter the bloodstream and can cause inflammation throughout the entire body, damaging organs and blood vessels in ways many seniors never connect to their dental care." Take the case of Arnold, a healthy, seeming 68-year-old who diligently brushed his teeth twice daily. During a routine physical, his doctor noticed telltale signs of gum inflammation, bacterial buildup on his tongue, and the distinctive odor that signals oral bacteria overgrowth. Based solely on these oral hygiene observations, the doctor ordered blood tests that revealed Arnold had undiagnosed prediabetes that was manifesting through his oral health first. "I had no idea my mouth was showing signs of disease before I felt any symptoms," Arnold later said. "I thought brushing was enough." Here's what you need to do immediately. Implement what dentists call the complete oral care triangle. It's not just about brushing. First, brush properly for a full 2 minutes, angling the brush toward the gum line where bacteria accumulate. Second, floss daily without exception. The areas between teeth harbor the most dangerous bacteria. Third, clean your tongue each morning with a proper tongue scraper, not just your toothbrush. Finally, rinse with an alcohol-free antimicrobial mouthwash specifically formulated for seniors. Don't wait until your next dental checkup to make these changes. The bacteria in your mouth are potentially entering your bloodstream right now, possibly damaging your heart, brain, and other vital organs. As we speak, have you checked your tongue in the mirror lately? The coating you might see isn't harmless. It's a dangerous bacterial biofilm that doctors recognize immediately as a warning sign. Mistake 2. Infrequent nail care and inspection. When was the last time you thoroughly examined your fingernails and toenails? The condition of your nails tells doctors volumes about your circulatory and immune health, often revealing problems months before other symptoms appear. Are you missing these critical warning signs? Geriatric specialists at Johns Hopkins Medicine confirm that nail changes are often the earliest visible signs of serious systemic diseases, including heart failure, liver disease, respiratory problems, and kidney dysfunction. Dr. Michael Thompson, a leading dermatologist, warns changes in nail thickness, color, shape, or texture aren't just cosmetic concerns. They're often the body's first visible distress signals that internal systems are failing, sometimes long before blood tests show abnormalities. Consider what happened to Elaine, a vibrant 77-year-old who didn't notice the subtle yellowing and thickening of her toenails until her physician pointed it out during a routine exam. These changes weren't just normal aging, they were early indicators of a circulatory problem that required immediate intervention. I was shocked when my doctor took one look at my toenails and ordered vascular testing, Elaine recalled. The tests confirmed I had peripheral artery disease that could have led to amputation if caught just a few months later. Here's what you must do starting today. Establish a weekly nail care routine that goes beyond just trimming. First, examine your nails in bright, natural light. Look for yellowish discoloration, thickening, brittleness, or changes in shape. Second, keep nails properly trimmed and filed to prevent bacteria from collecting under long nails. Third, thoroughly clean under each nail where dangerous pathogens hide. Fourth, moisturize the nail beds and cuticles to prevent cracking where infections can enter. Most importantly, learn the 5 nail changes that require immediate medical attention: new dark streaks, significant thickening, separation from the nail bed, unusual curvature, or brittle nails that break despite proper care. Have you inspected your nails this week? The warning signs of serious disease could be visible right now at your fingertips. Don't wait until it's too late. Your nails might be trying to tell you something your doctor would notice immediately. Mistake 3. Improper skin moisturizing techniques. Are you applying moisturizer incorrectly? The way seniors hydrate their skin can reveal hidden health conditions almost immediately to medical professionals. This mistake isn't just about looking older. It could be signaling dangerous internal issues. Dermatologists from Harvard Medical School emphasize that aging skin requires specific moisturizing methods to maintain its barrier function. Dr. Elizabeth Carter, Director of Geriatric Dermatology, explains, "The skin is our largest organ and a window into overall health. Improper hydration techniques don't just accelerate visible aging, they compromise the skin's ability to prevent infection and regulate temperature, while often signaling nutritional deficiencies or organ dysfunction that might otherwise go undetected." Robert, a 71-year-old retired accountant, was surprised when his doctor asked about his skincare routine during a regular checkup. Robert had developed concerning dry patches that his doctor immediately recognized not as normal dry skin, but as signs of potential nutritional deficiencies and kidney dysfunction. "I thought my skin was just getting older," Robert said. "I had no idea it was showing signs of internal problems." Here's what you need to change immediately in your skincare routine. First, timing is critical. Apply moisturizer within 3 minutes after bathing while your skin is still damp, which traps moisture rather than letting it evaporate. Second, use products containing ceramides and hyaluronic acid, which restore the skin's natural barrier rather than just sitting on the surface. Third, pay special attention to often neglected areas like lower legs, elbows, and the back of your hands, where doctors immediately notice signs of systemic problems. For maximum benefit, apply moisturizer using upward strokes, which improves circulation and lymphatic flow, 2 functions that naturally decline with age. And remember, excessive dryness or unusual patches, especially if asymmetrical, should never be dismissed as just aging. These could be early warning signs of diabetes, kidney disease, or nutritional deficiencies that your doctor would spot immediately. Is your skin trying to tell you something right now? Don't wait for a doctor to point it out. Proper moisturizing could be your first defense against hidden health issues. Mistake 4. Overlooking proper foot hygiene. Did you know that foot hygiene problems are among the first things doctors notice that indicate serious health concerns in elderly patients? Your feet might be revealing dangerous conditions right now that could threaten your mobility, independence, or even your life. Studies from the American Podiatric Medical Association show that an alarming 80% of seniors with diabetes or circulatory problems show visible foot hygiene issues before other symptoms appear. Dr. Jonathan Fisher, Chief of Podiatric Medicine at Boston Medical Center, warns, "The feet are the furthest point from the heart, making them the first place where circulation problems manifest." For seniors, neglected foot hygiene isn't just about comfort or appearance. It can literally be the difference between keeping and losing a limb. Take the case of Betty, a 76-year-old who had always been diligent about general cleanliness but neglected thorough foot care. During a routine examination, her doctor immediately noticed subtle signs between her toes, slight discoloration, minor scaling, and slight temperature differences between feet. These seemingly minor issues prompted further testing that revealed both circulation problems and the early stages of neuropathy. "I never would have connected my feet to heart problems," Betty said. "If my doctor hadn't recognized these signs early, I might have faced serious complications." Here's the crucial 3-step foot care protocol you must implement starting today. First, thorough daily washing with gentle antibacterial soap, paying special attention to the areas between toes where fungus and bacteria thrive. Second, complete drying, especially between toes. Moisture there creates the perfect environment for infections that can become dangerous quickly for seniors. Third, appropriate moisture barrier application. Use a specially formulated foot cream that hydrates without creating excess moisture. Most importantly, check your feet daily for any changes in color, temperature, sensation, or the appearance of even minor cuts or blisters. For seniors, especially those with diabetes, a simple foot injury can quickly become life-threatening if not addressed immediately. Are you giving your feet the attention they deserve? Your foot hygiene might be sending warning signals that a doctor would notice immediately. Don't wait until walking becomes painful or difficult. By then, it might be too late to reverse the damage. Mistake 5. Ignoring changes in body odor. Have you noticed subtle changes in your natural body scent? This seemingly embarrassing topic could actually be signaling serious internal health problems that doctors recognize immediately. Most seniors dismiss changes in body odor as a normal part of aging, but medical professionals know better, and what they can tell from these changes might shock you. Medical researchers from Johns Hopkins University confirm that specific changes in body odor can indicate liver problems, kidney dysfunction, and even certain types of cancer long before other symptoms appear. Dr. Rebecca Martinez, an internal medicine specialist, explains, "The body communicates through scent in ways many people don't realize. Metabolic disorders, organ dysfunction, and even certain cancers create specific volatile compounds that are excreted through the skin, creating distinct odor profiles that trained medical professionals can identify immediately." Consider what happened to Thomas, a 69-year-old retired teacher who was embarrassed when his doctor asked about changes in his body odor during a routine checkup. That simple question led to tests that caught an early-stage metabolic disorder before it became life-threatening. "I noticed my usual deodorant wasn't working as effectively, but I just thought it was part of getting older," Thomas recalled. "I had no idea it was my body trying to alert me to a serious internal problem." Here's what you need to do right away. First, track and document any unusual body odor changes, particularly if they persist despite proper hygiene. Second, use antibacterial soaps specifically formulated for seniors' more delicate skin pH needs. Third, change your clothing completely each day, as fabric can harbor bacteria that cause misleading odors. Fourth, stay properly hydrated. Many unusual odors in seniors stem from concentrated waste compounds due to insufficient water intake. Most importantly, never ignore a new or unusual body odor, especially one that persists despite proper hygiene. And avoid the common mistake of overwashing or using strong fragrances to mask odors, which can actually worsen the problem by disrupting your skin's natural bacterial balance. Have you noticed any changes in your body's natural scent lately? What your body is trying to tell you through these changes could save your life if addressed early. Don't let embarrassment prevent you from recognizing this critical warning sign. Mistake 6. Improper ear cleaning methods. Are you cleaning your ears incorrectly? This common mistake not only damages hearing, but signals potential neurological issues to healthcare providers. What you're doing to your ears might be causing irreversible damage while masking symptoms of more serious conditions. Otolaryngologists at the Mayo Clinic warn that improper ear cleaning methods, practiced by an astonishing 78% of seniors, can cause micro-traumas that accelerate hearing loss and potentially mask symptoms of more serious conditions. Dr. Andrew Wilson, head of audiology at Northwestern Memorial Hospital, cautions, "The ear canal is self-cleaning by design." When seniors use cotton swabs, hairpins, or other objects to clean inside their ears, they not only push wax deeper, causing impaction, but they create small injuries that can lead to chronic inflammation, infection, and accelerated hearing loss. Take the case of Shirley, a 74-year-old who had been using cotton swabs inside her ear canal for decades. During a routine examination, her doctor immediately noticed signs of trauma and inflammation that were not only causing preventable hearing loss, but also masking early symptoms of a treatable vestibular condition. "I thought I was being extra hygienic," Shirley explained. "I had no idea I was actually harming my ears and hiding symptoms my doctor needed to see." Here's how to properly care for your ears starting today. First, adopt the safe ear cleaning method recommended by the American Academy of Otolaryngology, using only warm washcloths on the outer ear and never inserting anything into the ear canal. Second, if you experience wax buildup, use only doctor-approved eardrops designed to safely soften wax, followed by gentle irrigation with warm water. Third, monitor for any new symptoms like ringing, fullness, or dizziness, which could indicate problems that proper ear examination would reveal. Remember, your ear canal has specialized skin that, when damaged, takes longer to heal as you age. Each time you insert something into your ear, you risk not only immediate injury, but also creating chronic inflammation that can mask more serious neurological symptoms. Are you putting your hearing and balance at risk with improper ear cleaning methods? Stop damaging your ears today before you cause irreversible harm. These 6 hygiene mistakes might seem minor, but they can reveal major health problems that could threaten your independence, quality of life, or even survival. The good news is that each of these issues can be corrected immediately with the simple, practical solutions I've shared. Your body is constantly sending signals about your health. Learning to recognize and address these warning signs could literally save your life. By implementing proper oral care beyond just brushing, establishing regular nail inspection, using correct moisturizing techniques, maintaining thorough foot hygiene, monitoring body odor changes, and cleaning your ears safely, you're not just improving your hygiene, you're potentially adding years of healthy, independent living to your life. The power to spot these warning signs before they become serious problems is now in your hands. If you found this information valuable, please hit the like button and subscribe to our channel for more potentially life-saving health advice. Comment below, which of these hygiene mistakes surprised you most? Were you making any of them without realizing the risks? Share this video with someone you care about who might benefit from this critical information. Your simple click could help someone avoid serious health complications or even save their life.